You ready? Okay, we're recording. Okay. Hello, Mr. Angel. My name is Victoria Angel. I'm an F&P student out of United States University. Today I need to do a video recording on the thoracic and lung area for a grade. Would you be okay if I recorded us and submitted it to YouTube for a grade?
Yes.
Okay, perfect. So when we go ahead and start the thoracic and lung exam, the first thing we do is we look at our patient as they're sitting there. We're looking for any signs of cyanosis in the lips to see if there's any discoloration, looking for signs and symptoms of any distress, retractions in the breathing. Normally the patient would be without their shirt on as they're sitting there, but for today we're not doing that. So we would sit here to evaluate again the breathing pattern. Normally the ratio, the AP ratio of the chest is 1 to 2. So again, listening just from a distance to see if there's any signs of distress with his breath, any abnormal sounds coming, any physical changes in his body as he's breathing. And at this time, his respiratory rate appears to be regular with about 16 to 18 breaths a minute. We're also going to look at the patient's hands for any signs of clubbing or cyanosis as well, because you would see some discoloration on the limbs. He doesn't appear to have any indications of cyanosis. Okay, once we've done our visual, the next that we go to is we palpate the patient just to kind of see if they're having any chest discomfort in the upper airways at all, any discomfort up here at all. Okay, perfect. We're going to move on to something that's called a Frimitus test. I'm going to use my hands and gently guide them down the front anterior portion of your body, and then we'll do your back. And I'm just checking for what's called tactile frimitus. So when I place my hands, we're going to say 99.
99, 99, 99.
Okay, go ahead and turn for me. And we're going to do the same thing back here to make sure I'm still on camera. Okay, go ahead and say 99.
99, 99, 99, 99.
Perfect. And as we're doing that, we're feeling for the vibration. Next, we're going to go ahead and we're going to palpate. Percuss the patient's back. So when we do it, we gently tap middle finger to middle finger and keep our other fingers up. And we're listening for like a dull type sound. We want to check all the different lung locations, including laterally. Okay, I'm going to have you spin back around just so I can percuss the front. Should have a tympanic type sound of a drum. Sometimes it's dull if it's over another area of the body. Okay, we're going to go ahead and get our stethoscope. I'll start up front here. We're going to go ahead and listen. We always make sure to start above the clavicle just because that's where the upper region of those lungs are. So we start up top. Go ahead and take a breath. Okay, another breath. 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 Okay, go ahead and turn around for me so we can model the back. As we listen to the breath sounds, we go in a ladder type fashion. Go ahead and take the breath in. We also want to make sure that we're listening to the lateral side of the lungs. One more on this side down here. Okay, perfect. Okay, and then again, while the patient would be sitting back here, we would gently put our hands, thumbs close together right around the spinal area and ask the patient to take a breath. Perfect. We're checking to make sure that our hands are showing that rise and fall symmetrically with the lungs. Another test that we check back here. Normally we would ask the patient to take a breath, and as the patient, again, they would not normally have their shirt on, so go ahead and take a breath, and we mark when they're holding, take a breath and hold it for me. Perfect. So we would mark up top there, and go ahead and exhale, and we would mark where the bottom of that sound is. So you would have a gap there, then you would measure the 2 lines, because you would want to mark on the skin, and you would measure, and it should be about 5 to 6 centimeters. We would repeat it on the right side of the patient as well, and those lines should be pretty symmetrical, and again, 5 to 6 centimeter range. All right. When a patient needs like a specialty test done, besides just doing the firmitus, we also want to do bronchoscopy, where we listen to the back of or we listen to the patient's lungs as they're repeating a sound. So as I move my stethoscope, with each movement, can you say 99?
Okay.
Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99,
Lateral again.
99.
Okay, I'm going to go ahead and listen up front. Can you spin through it? Thank you. Again, upper airways.
99, 99, 99, 99, 99, 99.
Perfect. Thank you. And the point of that is we want to make sure we should not hear the sound 99 very clearly. If we did hear it clearly, it would be an indicator that there is some form of fluid in there versus air. Okay. I think that completes our head, our thoracic and our lung exam for today.
All right.
Thank you.
Thank you.